And it is Heart Health Awareness Month, and our very own Zach Bruhl had a conversation with Dr. Chappell earlier this week to talk about ways you can manage your heart health as you age.
Heart Health Awareness is sponsored by Mackenzie Heart Group.
This morning on NBC 16 Today, we are honoring February, which is Heart Health Awareness Month. I'm joined today in studio by Dr. Chappell of the Mackenzie Heart Group, a cardiologist there, to talk about the importance of making sure you maintain your heart health as you advance in age. First of all, doctor, how are you this morning?
I'm good. I made it through the snow and up the hill, so I'm pretty happy about that.
Those are the first few steps that
Exactly.
you need, absolutely. Well, Dr. Chappell, for folks that are at home watching this that may be concerned a little bit about their heart as they're growing older, what kind of advice do you have, like elevator pitch style, for folks who may need to have a conversation with their doctor?
Well, I think probably one of the most important things is just understand your personal risk profile. I mean, there's guidelines out there. There's information about where your cholesterol should be, where your blood pressure should be. Sure. But what we try to do is individualize what one person's risk might be, may not be the same as another's. You can deal with your tobacco use, you can deal with your cholesterol.
Sure.
You can't really deal with your genetics. That's a deck of cards or a hand of cards that there's nothing you can do about. So you need to understand that risk and how it plays in with the other risk factors. So that's one of the most important things when I see somebody as a new patient who's sent to me because of a family history of coronary disease. You put that in context and then you figure out where the rest of the issues are regarding blood pressure, cholesterol, diabetes, lifestyle.
For folks at home, what's a good way to start this conversation with your doctor to get an idea of those things that are out of your control? Obviously, watching what you eat, watching what you consume, whether it's tobacco, alcohol, all those things, those are the easy ones to do.
Correct.
But like you said, the genetic predisposition, you don't have control over that. How do you start that conversation? What questions are important to ask?
Well, I think if you're going to your primary care provider and you are a man, maybe in his 40s, early 50s, especially if you have a family history of people who've had a coronary event, a stent, bypass surgery, maybe early stroke, bring that up to the doctor and demonstrate to the doctor that you are concerned about your vascular risk, and it'd be nice to start dealing with that in your 40s and prevent problems in your 60s and 70s, as opposed to dealing with it after you had your first event. For women, they're really relatively well protected for the most part with their hormones until they get to those perimenopausal years.
Sure.
And then one of the things that we now understand in cardiovascular medicine that maybe 25, 30 years ago was not as well understood is women's risk really starts to accelerate dramatically. So by the time we all get to our 60s and 70s, the risk for many women is actually higher than men.
So it's about those menopausal years when that that increased risk becomes an issue. Are there any warning signs for people that for women that are entering those premenopausal years that they may need to be aware of, or is it just about?
Not really. I mean, that's the issue. Again, if you have a family history of coronary disease and you're a woman in your 30s or 40s, it may not be a front burner issue, but as you hit those perimenopausal years, it's important that your primary care provider is working with you, checking your cholesterol panel every year, because things can start to really change rapidly, and you need to decide if you're one of those people that would benefit from a treatment, for example, for cholesterol or for blood pressure.
Now, full disclosure, I have my fiance worked very closely with you in the cath lab there at Mackenzie Willamette Hospital, and the advances, the stories she'd come home with about the ways that you guys address these heart issues were out of a science fiction movie. What sort of advances are you guys using, and how can you pair that up with treatments to make sure people are able to keep their heart as healthy as possible as they grow older?
Well, and that's been one of the privileges of practicing medicine. I've been here 34 years. I mean, the changes that I've seen here in this community, but also the science of cardiovascular medicine in general is pretty mind-boggling. We have much better medications. We have better tools to take care of people. We have valves that we can put in without opening the chest in the appropriate patient. Our surgical colleagues have techniques to protect the heart during bypass surgery or doing high-risk surgery that weren't even considered when I started doing this 35 years ago. So it's that's been the really exciting part, and what your fiance and I work with in the cath lab is exciting and it's fun, and it's great to be able to see patients who are in trouble and get them out of trouble, and that's very rewarding and very exciting. But it'd be nice if the patients never got to that point in the first place. I mean, to stay away from us is great if you can do that.
Yeah, I like seeing you here. I don't need to see you in the scrubs at any point.
Exactly.
But young men like me could be doing things now to make themselves better set up? Because you talked about it. Those men that hit that age 50, women, once they hit those premenopausal years, that's when those risks start to increase. But what kind of action would you suggest younger folks to take to make sure that they're setting themselves up for success later in life?
Well, that's a really good question. I mean, one thing is to know what your blood pressure is, get a good upper arm blood pressure cuff, not the little wrist ones, and know that the guidelines are that we want that systolic number, that top number below 130 and the bottom number below 80. If you're overweight, if you're deconditioned, if you're eating poorly, that can really drive the blood pressure up. But again, genetics can play a huge role. Even if you're doing everything right, you can sometimes end up with blood pressure that we need to treat. And the patients who are like that are sometimes resistant to the idea that, what do you mean, why do I have to take a medication? I ran 3 marathons last year, and well, because your mom and dad both had high blood pressure, and we have to manage that. Knowing your cholesterol numbers, knowing your blood sugar, knowing if you have a tendency to diabetes, keeping your weight under control, exercising regularly. I mean, all those are things that we need to start doing at a young age.
Nothing you can do about that genetic predisposition, or else I'd probably have a better head of hair these days.
Me as well.
Yeah,
Me as well.
no kidding.
Yeah.
Dr. Chappell, I think those were all the questions I had prepared for you. Is there anything else you'd like to add or a message you'd like to send to folks at home watching that are concerned about theirs or their family members' heart health?
Times change based on treatment, and probably the most dramatic example of that is the whole question about aspirin as a preventative for heart disease. 25, 30 years ago, the guidelines were there. Almost everybody above the age of 50 should be on a little baby aspirin. Those guidelines have changed. And now if you've had a heart attack, if you've had a stent or stroke, absolutely, aspirin's indicated, but for primary prevention, not so much. That's because the science moved on, the cholesterol medicines got better and cheaper, they're generic, the primary care providers are starting them earlier. So now, if we talk about the American population as a herd, the benefit of giving everybody in the herd aspirin is no longer there.
Sure.
So that's a good example of how the providers really have to keep up with the science and understand how things change.
Sounds to me like the moral of the story is one very similar to one we experience here in the newsroom. Find good sources of information and trust those sources. So talk to your doctor about the risks that you may be facing and how best to keep yourselves away from those risks.
Exactly.
Doctor, thank you
Well
so much
said.
for joining us this
Good.
morning. It's a
Good.
pleasure to have you here.
Good.
Away from those risks.
Exactly.
Doctor, thank you
Well
so much
said.
for joining us this
Good.
morning. It's a
Good.
pleasure to have you here.